Welcome back. This is Daybreak, and thank you for staying with us. The hashtag on X is Citizen Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikad. Nelson Havi is the former Law Society of Kenya president with us in studio here. Good morning, Nelson.
Good morning, Ayub.
Lovely having you here on the broadcast.
Thank you.
And what a time as well to have this discussion. Dan Okach is an advocate of the High Court also with us in studio this morning. Good morning, Dan.
Good morning, Ayub.
Thanks for making time for the broadcast. And Demas Kiprono will be joining us shortly here. He is the acting executive director, ICJ Kenya, as we take stock of the developments in the country. Gentlemen, let's begin with a look at the front pages of the publications. And this is one thing that matters to Kenyans is on healthcare. Adani linked SHA hospital system fails, says the paper on the front page. The Safaricom-led consortium has signed up a fourth partner to provide a portal to process claims by private health facilities in a potentially costly deal crafted without taxpayers' knowledge after the original supplier of the software had failed to deliver on time. It says this follows the failure of the health management system. Another firm was brought in to plug the hole as the consortium worked on the one it had developed. Coming to you first, Council Harvey, it seems that for a very critical component and a pillar like healthcare, we are not getting it right.
Well, I'm reasonably apprehensive of being told to shut up and stop acting stupid on matters that I do not know. But the reality is here on the Caltas. This system is not functional. What was the propriety of replacing the system that was in place before this? And what is the competence of the individual who was procured to undertake this important exercise? You know, the healthcare system in Kenya has failed. And some of us who relate to the people on the ground are able to report. There is a lot of suffering. People are dying. People are unable to meet their medical needs. And what is the government doing about it? Completely nothing. It continues to incorporate individuals whose only agenda is to plunder and plunder and plunder. But the anathema in this issue that how do you plunder the health system? It's a big problem. I don't know how we'll get it out of this quandary.
But certainly it needs a visionary leadership, is it, to drive us out of this crisis, certainly. And it's the money in question, it's the modus operandi in question, it's the people in question, and certainly this company, which is again shrouded in secrecy, because there were levels of other web of companies that had formed the consortium, and this again coming up of the inability, the capacity questions. I mean, how then will the leadership respond to this beyond speaking out about the criticism that Kenyans have against this healthcare system?
I've posited this time without number, Ayub. The complexity of government as it is in Kenya is intended to shroud simplistic issues. And the main goal is to create an environment for stealing from the public. Look, when I grew up in Nangili and I would fall sick, all I needed to do was to mount my bicycle and cycle to Kongoni dispensary, where there will be a nurse or a doctor, there will be a laboratory, there will be medicine. I will be given an injection of chloroquine and Piriton, and the malaria will be gone. I paid nothing. So why all these complex things? We have this infrastructure in place. Let us just have a system that is functional. People go to hospital or designated dispensary where they will be treated. Let the doctors be paid. Let the nurses be paid. Let there be medicine in this infrastructure. We don't need all these complex issues. It cannot be the function of government to provide healthcare insurance. It never should be, especially in a developing country like Kenya. So in closing, they are complicating an otherwise simple, straightforward matter to get room for theft, simply put.
Okay. Wakili Dan Okach, again, another concern is from the Kenya Rural Urban Hospitals Association. Through Dr. Brian Lishenga yesterday said, why wasn't the contract with Savannah Informatics made public? This is the new entrant. It's a matter of public interest. Without Savannah, we wouldn't have a functioning system today, but Kenyans deserve to know the terms and the costs involved. there seems to be a continuity, a culture of kicking the can down the road and shrouding all these companies and all the personnel involved in secrecy. How will the government come clean of this, even as it attempts to provide the healthcare that Kenyans require?
Yes, thank you, Ayub. I said it in this particular show sometimes back, that ideally, when you talk about healthcare, you cannot come and do trial and error with the health of Kenyans or any human being. It is not supposed to be there. In fact, if you look at even trials in terms of medical advances, from time immemorial, they've always tested it on animals. And even there are other people saying even that is not proper. That tells you that if we are going to introduce something that will affect Kenyans in terms of their health or their access to health care, we must be 100% sure of that. We cannot bring it as a trial and error. The reason for that is that if there's any error or in terms of that particular process, it will be so difficult to revive someone who has died because we have lost a life. And that is why it is so costly when we've been doing trial and error in other areas, but when it comes to healthcare, someone sat down somewhere and said, let's introduce this. You must, first of all, have looked into this. Kenya is not the first country to introduce this kind of healthcare or the insurance attached to it. There must have been proper, proper survey, proper diagnosis of what would ail if we bring it here, so that by the time we are bringing it here, we are sure. Ideally, we will even do a proper dry run pilot, program, whereby by the time you roll it out, and say that NHIF is not there, you are 100% sure. So that's why and I've always said, I believe there was it was in good faith that these particular programs were introduced. But I think the problem is in terms of how it was crafted and in terms of the implementation. And the problem is that we are dealing with healthcare. There are many people suffering, like Harvey, the president, has said, that many people are really suffering. And if you look at the architecture of this particular process, you realize there's a problem. And that is why we are patching up this process as we proceed. And we are not patching it up in a proper manner. Because in the manner of patching it up, first of all, there is secrecy. More importantly, we are going against the law because we have our law that provides how we should procure certain services for the country. So if we have just been told, that, like you have read, that there is another firm that was brought in to actually patch the holes, it is important. Maybe it was what was needed to save lives. But again, that tells you that if it was properly done, we will not be bringing these patch-ups along the process.
Yeah. And Council Harvey, if you look at what, for example, Safaricom as an individual entity had offered to provide the Minister of Health in January, and this was to implement the tax system for the new healthcare scheme. It was at a cost of 48.3 billion Kenya shillings, including taxes. Then somewhere along the way, the Health Ministry and Safaricom disregarded the initial proposal. Adani came in, consortium was formed, web of companies, through proxies, then that figure jumped to 104 billion Kenya shillings. Then there's that mathematically 56 billion Kenya shillings that should be and must be accounted for. Then comes in Parliament, that comes in other authorities that ought to be looking and providing a keen eye to this. Why then do you think for the same services, in your view, prices were hiked for the 15 services that Safaricom would provide with 48, then the consortium said in May that it can provide the same services, 15 of them, with 104 billion Kenya shillings. And there are question marks about this.
First and foremost, this elaborate layering of entities is intended to conceal the real individuals behind this haste. That's number one. Number two, the complication of the entire enterprise is intended to skyrocket the cost of an otherwise simple, straightforward enterprise. To what goal? To enable people steal money. And you see, as we have said before, Duncan and myself, how do you steal from the sick? It is synonymous to stealing from the dead. Where I come from, that is a curse. Whoever in government is involved in this exercise should be extremely ashamed of himself. I really do not know what will inform such a perilous course that will put into jeopardy the health of Kenyans. And this by individuals who have capacity to do right, demonstrable. It beats logic that they will engage in this exercise, knowing very well that it's going to cost a lot of money to the taxpayer, it's going to cost death, it's going to cause pain. To what end? You get elected for purposes of defending and protecting the people, not decimating the people, not destroying the people, not prejudicing the people. Because if that is your intention, who will elect you? These people will be dead. You understand? You are collapsing the state.
So it's zero-sum.
It did.
And Dan Okach, from your observation since this rollout happened, have you observed a proper planning for the out-of-pocket expenditure, which was inevitable when this system was introduced?
Of course, I've not observed that, because even by the time you are dealing with that, the core function is not actually being actualized when you look at the primary receivers of these particular services. So ideally, when you look at it, you find that Kenyans and in fact private hospitals will be the beneficiaries, and that would only happen in terms of benefiting those who have. Because majority of Kenyans, and you look at these surveys, the rich, there is a small clique of those who are continuing to be rich, and majority are still languishing in poverty. So if we were saying that, I think maybe Harvey should look at it from the dimension that this government said it's a hustlers government. So the intention is to ensure we have, if not the same number of hustlers, but more, as opposed to removing them into that bracket, where now they will at least now...
Can I stop being a hustler? I'm now a farmer, and I also want to be president, because this hustler business is just...
it actually...
It's no longer tenable.
No, it's not.
People are languishing, and you see, I'd rather they languish in poverty, fine, but when it comes to healthcare, when it comes to your life, where the Constitution guarantees your life, then the government is actually negating a very important thing. Ideally, everything should stop, in my view. All these shows we are seeing should stop, and we sort out this mess first in terms of healthcare. The rest can continue afterwards. But we build roads, we say we are having steel factories and whatever, even coffins are not actually built by steel.
Okay.
So we need to ensure that, first of all, these people are alive to even occupy these houses that we are going to build. They're of good health. We have children who will be of good health. If we cannot at least maintain that as the bare minimum, we do not have a country, we do not have a society.
Let's turn our attention to also on the front page of the Standard newspaper. And Council Harvey, coming to you, Ruto